Prior to the dental extraction procedure, you are taking anticoagulant like warfarin, Aliquis, or Xarelto. You should know what to do prior to dental extraction. If a simple extraction, like one tooth extraction, I would recommend not hold any platinum patient. But I would recommend test your eye now prior to the procedure if you are not stable. If your eye now you have a lot of eye now out range, especially higher your upper range. You should check your eye now prior to procedure to avoid bleeding. So, if you have multiple tooth extractions, then I would recommend to hold from 2 to 5 days prior to the procedure. You should check with your dentist or oral surgeon. You see what they expect. Some dentists they may tell you they want eye between 2 and 3, or they want eye less than 2 prior to the procedure. Then you will let your doctor who manage your warfarin know that your eye expect to be at certain level prior to the procedure. Usually, they want your eye on the day or within 24 hours prior to the procedure. So if depend if your eye excuse me, if your eye not stable, or higher than the upper range, like a week or 2 weeks prior to the procedure, then your doctor may recommend that you should hold your warfarin to make sure you get or you achieve the eye goal. Expect to be within 24 hours. So, for example, if your eye like 3.5, 2 weeks prior to the procedure, right? So, I would recommend you need to hold your warfarin 1-2 days prior to the procedure, and then you need to detach the eye on the day of procedure. So to make sure your eye at 2.3, 2 to 3, that what your dentist want. If your dentist want your eye less than 2 prior to the procedure, then you might need to hold for 3 days. If your eye for 3.5, 2 weeks prior to the procedure, and you need to hold like 3 days prior to the procedure to make sure your eye less than 2. So it still depends on what your dentist want or expect your eye level or goal before the procedure. If you have to hold your eye hold your warfarin for 5 days prior to the procedure. Okay, sometimes they have difficult or multiple tooth extraction. They might want you to hold for 5 days prior to the procedure. They want the eye level less than 1.5. And you need to hold your warfarin might be for 5 days or more, depending on your iron level. So you have to follow your doctor closely to make sure uh, you don't have any bleeding. So if you have to hold your warfarin for 5 days to get the iron uh, at less than 1.5, then you may need to be breached with the low enough injection or enoxaparin injection to avoid, you know, the blood clot or stroke, because you take warfarin to prevent the blood clot or stroke. And then if you require to reach with the low enough injection, then there's a instruction, when to start the low enough and when to resume low enough injection. You have to follow the doctor who manage the doctor who managed your warfarin. Um, if you take Eliquis, Xarelto, or Badaxa, it's easier to manage prior to the procedure. Um, Generally, for a simple extraction, you don't have to hold Eliquis, Xarelto, or Badaxa. But for multiple tube extractions or extensive oral surgery, then you might need to hold for 1 to 2 days this medication prior to the procedure. You don't have to be rich with the luminal injection when you hold less than 3 days. I think generally is safe, except for certain patients. Um, they are so sensitive when they hold their blood thinner medication, even though 2 days, they may develop the blood clot or stroke. So for those patients, um, you know, the surgeon or the proceduralist might need to consider the risk and benefits of holding the blood thinner medication. So that is very complicated. Patient need to work closely. They may need to be uh, stay at the hospital uh, before the procedure to make sure they are safe, or stay after the procedure for days to make sure they are safe from bleeding or blood clot or stroke. If you have to hold your warfarin or the Eliquis, Xarelto, Badaxa, then um, resume your blood thinner medication as instructed by dental or the surgeon. So, prior to the dental extraction procedure, you need to know if that a single extraction or multiple tool extraction. If simple extraction, you may not need to hold your blood thinner medication. If multiple tools extraction or extensive oral surgery, then you may need to hold your warfarin for 2 to 5 days, depending on your iron level. And then if you hold more than 3 days, then depending on your medical condition, you need to be breached with the luminal injection to make sure you are safe from blood clot or stroke. And if you take Eliquis, Xarelto, or Badaxa, you may require to hold 1 to 2 days prior to the multiple tooth extraction or extensive oral surgery. And then you should resume your blood thinner medication as instructed by your dental. And if you have to be bridged with Lovenox injection, then you have to follow your doctor who manage your warfarin to make sure you know what day you need to start the Lovenox and what day and when you resume your Lovenox and when to stop the Lovenox injection. All right, if you have any further questions for this dental extraction procedure, please let me know in comment below. Thank you. For the dental cleaning procedure, what you need to do prior to dental cleaning procedure, if you are taking blood thinner medication like warfarin, Aliquid, Roto, Badaxa, so I would recommend that you should not hold blood thinner medication for routine dental cleaning. If your INA, if you're taking warfarin, you need to make sure you are stable with your INA level. You don't have clinical INA before routine cleaning. If you have critical INA, probably you need to hold your warfarin for a few days in order to get your INA to the therapeutic level. So avoid your routine cleaning if you just have the critical INA like over 5 or your INA over 6 or you have any kind of active bleeding when over or blood thinner medication. For the deep cleaning, if you have to have a deep cleaning on blood thinner medication, might consider to hold your warfarin. You need to check with your doctor who manage your blood thinner medication. They have to review your INA history, and then they will give you some recommendation on your warfarin and your INA history. Generally, if you have a stable INA history, then you know, and then your current INA is therapeutic, then they may recommend that you hold for 1 day prior to the procedure. If your INA, you know, if your INA is not stable and has the history of elevated INA, then they may recommend that you should hold for 3 days prior to the procedure. But they need to test your INA prior to the procedure, usually within 24 hours of the procedure. And then if you are taking the Aliquid, Yeroto, Abadaxa, and then you don't have any kind of bleeding or anything, any active bleeding, such as nose bleeding, stomach bleeding, or blood in your urine. And then you might need to hold for 1 day, right, to keep cleaning. And again, if your dentist, they are not concerned about your bleeding, then they don't recommend you have to hold your blood thinner medication, then you should not hold your blood thinner medication. You don't have any concern about bleeding. If you are uh, stable with your warfarin doses, and then you have a good history of your INR therapeutic for a long time, then you should follow your dental recommendation. If you have concern, you should always ask your doctor who manage your warfarin. Make sure you are safe from any procedure. Okay. If you hold your warfarin or your Eliquis, you should resume your blood thinner medication as instructed by dental. If you have any question, you ask your doctor who manage your warfarin when you resume your blood thinner medication. Generally, if you don't have any kind of bleeding or if you don't have any instruction from your dental when to resume your warfarin, then you know your doctor who manages warfarin might have you to resume your warfarin uh, after the procedure, but you need to double check so you are safe. All right. So, any further question or any concern prior to dental procedure? What you need to do when you are taking the blood thinner medication? Please let me know in the comment below. Thank you. Bye. Before a dental root canal procedure, what should you do if you are on blood thinner medication, such as warfarin, Eliquis, Xarelto, Bardexa. Um, I would recommend you should not hold your blood thinner medication. Otherwise, as instructed by your doctor or your anticoagulant. If you if you have unstable iron history, uh, your uh, recent iron was critical, too high, then you should check your iron prior to the procedure to make sure you are safe from the procedure. Um, if your iron is therapeutic or you have history of stable iron, good iron history, then you don't have to hold your warfarin right to, unless otherwise as instructed by your um, doctor who manage your warfarin or the anticoagulant. Or if your dental or your oral surgeon recommend that you should hold your blood thinner medication, then you need to discuss with your um, doctor who manage your warfarin or the anticoagulant to make sure that you hold your blood thinner medication appropriately. So if you have unstable iron history or your iron was critical recently, you should check your iron, make sure you are safe. Um, and if you have any active bleeding, you should let your doctor or your anticoag clinic know that you have some kind of bleeding, like nose bleeding, stomach bleeding, or blood in urine. You should let your doctor and your dentist, the oral surgeon know before the procedure. Your dental or your oral surgeon may request or may require you to hold your warfarin or your Eliquis, your Atovadexa. So if you require to hold your warfarin, work with your doctor or your anticoagulant, how many days you should hold your warfarin, or what is the iron level they want before the procedure. And then if you require to hold your Eliquis, Xarelto, or Bardexa, then I would recommend you should hold for 1 day prior to the procedure. And if you have to hold your warfarin or your Eliquis, Xarelto, or Bardexa, then you need to resume your blood thinner medication instructed by your dental or your oral surgeon. If you don't have any instruction or any recommendation from your dental oral surgeon, then you need to check with your doctor who manage your warfarin or your anticoagulant to see if they have any. If you have any further question or concern prior to a dental root canal procedure, please let me know in the comment below. prior to a total knee replacement surgery. So, what should you do if you are on platinum medication? If you are taking warfarin, then your doctor who manage your warfarin for the Humulin clinic, they might reject your INA about 2 weeks prior to the procedure. Um, Depend your INA result or your INA history. Then if it's too high, then they adjust your warfarin dose and have you to back in 1 week. And then if you are getting better or get into the range, then they may hold for often for 4 to 5 days prior to the procedure. And if you have a history of recurrent iron, recurrent blood clot or recurrent stroke, then they might need to bridge you with the low injection. Okay, so when they have to bridge you with the low injection, they need to make sure you have up to days kidney labs, the within 3 months of your kidney lab, and then your current weight in order to dose Lovenox. So there are some instructions regarding when to start your Lovenox injection and when to resume your. You need to follow doctor or like make sure take reach the Lovenox injection correctly. And then if you take Aliquid, Gerotobadexa, your doctor, excuse me, your doctor who managed your platinum medication for the anticoagulant might check your kidney function. They need to update the labs that needed, usually within 3 months, and your labs okay. But if it's over 3 months, then they should recheck your kidney labs, your renal labs, so they can give you the good recommendation. If you have a normal kidney function, then probably you should need to hold for like 2 days prior to the total replacement surgery. If your kidney function, if you have some kind of acute kidney problem or have a chronic kidney disease, then based on your creatinine clearance, and they will recommend that you might need to hold more than 2 days. Now, if you have bad kidney function, then you might hold 3 days of depend on your function. And then if you have to hold your warfarin for 5 days, your Aliquid for 2 days or more, your Yerotobadexa 2 days or more, then you need to check with your surgeon or the proceduralist to see when you can resume your platinum medication. Generally, for warfarin, you may resume your warfarin the day after procedure if okay with surgeon. And then for the Aliquid, Yerotobadexa, yes, the same thing. You may need to resume this medication a day after the procedure. But if you have a bad kidney function and you have to hold more than 2 days, then probably you need to resume your Aliquid, Yerotobadexa maybe 2 or 3 days after the procedure. Again, you follow your doctor or the anticoagulant to manage your blood thinner medication, and your surgeon or a proceduralist. Have any further question or concern, let me know in those. Prior to the dental extraction procedure, you are taking anticoagulant like warfarin, Aliquis, or Xarelto. You should know what to do prior to dental extraction. If a simple extraction, like one tooth extraction, I would recommend not hold any platinum patient. But I would recommend test your eye now prior to the procedure if you are not stable. If your eye now you have a lot of eye now out range, especially uh, higher your upper range. You should check your eye now prior to procedure to avoid bleeding. So, if you have multiple tooth extractions, then I would recommend to hold from 2 to 5 days prior to the procedure. You should check with your dentist or oral surgeon. You see what they expect. Some dentists they may tell you they want iron between 2 and 3, or they want iron less than 2 prior to the procedure. Then you will let your doctor who manage your warfarin know that your iron expect to be at certain level prior to the procedure. Usually, they want your iron on the day or within 24 hours prior to the procedure. So if depend if your iron excuse me, if your iron not stable, or higher than the upper range, like a week or 2 weeks prior to the procedure, then your doctor may recommend that you should hold your warfarin to make sure you get or you achieve the iron goal expect to be uh, within 24 hours. So, for example, if your INR like 3.5, 2 weeks prior to the procedure, right? So, um, I would recommend, you need to hold your warfarin uh, 1, 2 days prior to the procedure, and then you need to detach the INR on the day of procedure. So, to make sure your INR at 2.3, I mean 2 to 3, that what your dentist want. If your dentist want your INR less than 2 prior to the procedure, then you might need to hold for 3 days. If your INR, uh, you know, were 3.5, 2 weeks prior to the procedure, and you need to hold like 3 days prior to the procedure to make sure your INR less than 2. So it still depends on what your dentist want or expect your INR level or goal before the procedure. If you have to hold your INR, I mean hold your warfarin for 5 days prior to the procedure. Okay, um, sometimes they have difficult or multiple tooth extraction. Um, they might want you to hold for 5 days prior to the procedure. They want the INR level less than 1.5. And you need to hold your warfarin might be for 5 days or more, depending on your INR level. So you have to follow your doctor closely to make sure uh, you don't have any bleeding. So if you have to hold your warfarin for 5 days to get the INR uh, at less than 1.5, then you might need to be breached with the lower knob injection or inoxaparin injection to avoid, you know, the blood clot or stroke, because you take warfarin to prevent the blood clot or stroke. And then if you require to breach with the lower knob injection, then there's a instruction, when to start the lower nose and when to resume lower nose injection. You have to follow the doctor who manage, the doctor who managed your warfarin. Um, if you take Eliquid, Xarelto, or Badaxa, it's easier to manage prior to the procedure. Um, Generally, for a simple extraction, you don't have to hold Eliquid, Xarelto, or Badaxa. But for multiple tooth extractions or extensive oral surgery, then you might need to hold for 1 to 2 days this medication prior to the procedure. You don't have to be rich with the luminal injection when you hold less than 3 days. I think generally is safe, except for certain patients. Um, they are so sensitive when they hold their blood thinner medication, even though 2 days they may develop the blood clot or stroke. So for those patients, um, you know, the surgeon or the proceduralist might need to consider the risk and benefits of holding the blood thinner medication. So that's a very complicated patient. Need to work closely. They may need to be uh, stay at the hospital uh, before the procedure to make sure they are safe or stay after the procedure for days to make sure they are safe from bleeding or blood clot or stroke. If you have to hold your warfarin or the aliquid erythropoiesis, then um, resume your blood thinner medication as instructed by dental or the surgeon. So, prior to the dental extraction procedure, you need to know if that a simple extraction or multiple tool extraction. If simple extraction, you may not need to hold your blood thinner medication. If multiple tools extraction or extensive oral surgery, then you may need to hold your warfarin for 2 to 5 days, depending on your I9 level. And then if you hold more than 3 days, then depending on your medical condition, you need to be breached with the luminal injection to make sure you are safe from blood clot or stroke. And if you take aliquid erythropoiesis, you may require to hold 1 to 2 days prior to the multiple tooth extraction or extensive oral surgery. And then you should resume your blood thinner medication as instructed by your dental. And if you have to be breached with luminal injection, then you have to follow your doctor who manage your warfarin to make sure what day you need to start the Lovenox and what day and when you resume your Lovenox and when to stop the Lovenox injection. All right, if you have any further question for this dental extraction procedure, please let me know in comment below. Thank you. Prior to dental fillings procedure, what should you do if you are on platinum medication, such as warfarin, Eliquis, Xarelto, or Bedaxa? You don't have to hold your platinum medication prior to a dental fillings procedure unless otherwise as instructed by your doctor who manage your warfarin or your anticoagulant or um, your dental or your oral surgeon. Okay. Um, if you have a unstable, you have an unstable INR history, then you might consider to recheck your INR. If you have uh, a critical INR recently, then you should check your INR, make sure your INR is not too high prior to the procedure. If you have any active bleeding, you should let your dental or your surgeon know that you have active bleeding. But I don't think that they need to do. They need to postpone the procedure. This procedure because you have bleeding, you are not too high. But if you need to talk to them to make sure they don't do anything else besides the fillings. They require you to hold your warfarin, and you need to follow your doctor who managed the platinum medication or the anticoagulant. And if they require you, if you're taking the Eliquis, Xarelto, or Bedaxa, and they require you to hold your platinum medication for a day prior to the procedure, you have to hold. And if you have to hold your platinum medication, then you resume your platinum medication instructed by your dentist or your surgeon. If they don't have any recommendation, they have no idea when to resume, then you need to check with your doctor who manage your platinum medication or the anticoagulant, the when you should resume platinum medication. If you don't have any higher bleeding after procedure, then might resume the platinum medication the day after the, or even uh, same, same day of the procedure. You have no bleeding. So, all right. So again, before a dental fillings procedure, you don't have to hold any platinum medication. That's otherwise as instructed. And then you don't have any stable INR history, critical INR recently, then check your INR to the higher bleeding risk procedure. And I just say for the fillings, you should not worry about INR history or bleeding. But if you have live threatening bleeding, probably do anything. Have to hospitalize, and they have puzzle agent push your bleeding back to normal. All right. If you have any further question or concern prior to a dental procedure, please let me know in the comment below. Thank you. Hey, prior to a dental grounds procedure, what should you do if you are on platinum medication? With warfarin, Eliquis, Geroto, Badaxa, um, I would recommend should not hold any platinum medication prior to this procedure. Otherwise, as instructed by your doctor who manage your warfarin or platinum medication or hypo. Um, you should check your iron warfarin if you have a uh, critical iron recently. If your iron history not stable, um, you have active bleeding like blood in urine, stool, cough up with blood, stomach bleeding, nose bleeding, and like that, then you need to let your dentist dental know that you have some concern with your healing. Excuse me. And then you might need to make sure your iron not too high prior to avoid any major bleeding. Um, sometimes your dental may find something that may want to do add this additional procedure, then uh, will cause a problem. They're not aware of you critical iron, your active bleeding. That if they want you to hold your open prior to dental brows procedure, then you need to discuss with your doctor who manage your warfarin or other platinum medication, or you need to discuss with anticoagulant. Sure, you have the instruction safe, and then if they want you to hold your Eliquis, Yeroto, or Badaxa prior to the procedure, For this procedure, you may need to only hold the blood thinner medication for a day prior to the. Again, you need to talk to then your doctor who may or your allergic, your auto, but that or talk to your anticoagulant for the instruction. If you have to hold your blood thinner medication prior to the procedure, then you should ask your dental when to resume your blood thinner medication. If they don't have any instruction or any recommendation, then you need to discuss with your doctor who may blood thinner medication or the anticoagulant. Um, Generally, if you don't have any bleeding after the procedure, right, resume the blood thinner medication on the same day or a day after the procedure. If you have any question, any further question, then let me know in the comment below. What should you do prior to a dental caps procedure? You don't have to hold your blood thinner medication prior to the dental cap procedure. That's by by your doctor who manage your blood thinner medication or anticoagulant. If you are taking warfarin and you don't have a stable NR history and you have a critical INR recently, and you might need to check your INR prior to and unless your dental oral surgeon know that you have critical INR recently. If you have any active bleeding, know to make sure everything's safe. They don't do it now besides the dental caps procedure. And if they want you to hold your warfarin prior to this procedure, then you probably need to discuss with your doctor for platinum medication or the anticoagulant for recommendation. Uh, if you have to hold your warfarin, follow your doctor or the anticoagulant instruction. If you have to hold your Eliquis, Xylitol, or Bedexa, then I need to 1 day, right? Need it again, and you need to discuss for doctor any recommend or hold. If you have to hold your warfarin or Eliquis, Xylitol, or Bedexa, you need to check dental, see when you consume your platinum. If they don't have any instruction, why when you need to read, then you need to consult with your doctor who manage your platinum medication or your hypoac for the instruction. You have no active bleed, they might ask you to resume the platinum medication same day after the right. So prior to a dental caps procedure, you don't have to hold for platinum medication unless otherwise as instructed. Check your INI if needed. Critical INI recently for INI history not stable. You have active. You should let your dental, your healthcare providers, surgeon know if you have any concern like active bleeding or any major bleeding that you have in that track for platinum medication. Okay, if you have any further question, concern, please let know in those. before a dental root canal procedure, what should you do if you are on platinum medication, such as warfarin, Eliquis, Xarelto, Bardaxa? Um, I would recommend you should not hold your platinum medication. Otherwise, as instructed by your doctor or your anticoagulant. If you if you have unstable iron history, uh, your uh, recent iron was critical, too high, then you should check your iron prior to the procedure to make sure you are safe from the procedure. Um, if your iron is therapeutic or you have history of stable iron, good iron history, then you don't have to hold your warfarin right to, unless otherwise as instructed by your um, doctor who manage your warfarin or the anticoagulant. Or if your dental or your oral surgeon recommend that you should hold your platinum medication, then you need to discuss with your um, doctor who manage your warfarin or the anticoagulant to make sure that you hold the platinum medication appropriately. So if you have unstable iron history or your iron was critical recently, you should check your iron, make sure you are safe. Um, and if you have any active bleeding, you should let your doctor or your anticoag clinic know that you have some kind of bleeding, like nose bleeding, stomach bleeding, or blood in urine. You should let your doctor and your dentist or oral surgeon know before the procedure. Your dental or your oral surgeon may request or may require you to hold your warfarin or your Eliquis, your Xarelto, Bardaxa. So if you require to hold your warfarin, work with your doctor or your anticoagulant, how many days you should hold your warfarin, or what is the iron level they want before a procedure. And then if you require to hold your Eliquis, Xarelto, or Bardaxa, then I would recommend you should hold for 1 day prior to the procedure. And if you have to hold your warfarin or your Eliquis, Xarelto, or Bardaxa, then you need to resume your platinum medication instructed by your dental or your oral surgeon. If you don't have any instruction or any recommendation from your dental oral surgeon, then you need to check with your doctor who manage your warfarin or your anticoagulant to see if they have any. If you have any further question or concern, right, to a dental root canal procedure, please let me know in the comment below. Prior to the dental extraction procedure, you are taking anticoagulant like warfarin, Aliquis, or Xarelto. You should know what to do prior to dental extraction. If a simple extraction, like one tooth extraction, I would recommend not hold any pertinent patient. But I would recommend test your eye now prior to the procedure if you are not stable. If your eye now you have a lot of eye now out range, especially higher your upper range. You should check your eye now prior to procedure to avoid bleeding. So, if you have multiple tooth extractions, then I would recommend to hold from 2 to 5 days prior to the procedure. You should check with your dentist or oral surgeon. You see what they expect. Some dentists they may tell you they want eye between 2 and 3, or they want eye less than 2 prior to the procedure. Then you will let your doctor who manage your warfarin know that your eye expect to be at certain level prior to the procedure. Usually, they want your eye on the day or within 24 hours prior to the procedure. So if depend if your eye excuse me, if your eye not stable, or higher than the upper range, like a week or 2 weeks prior to the procedure, then your doctor may recommend that you should hold your warfarin to make sure you get or you achieve the INR goal. Expect to be within 24 hours. So, for example, if your INR like 3.5, 2 weeks prior to the procedure, right? So, I would recommend you need to hold your warfarin 1-2 days prior to the procedure, and then you need to detach the eye now the day of procedure. So to make sure your eye at 2.3, 2 to 3, that what your dentist want. If your dentist want your eye less than 2 prior to the procedure, then you might need to hold for 3 days. If your eye for 3.5, 2 weeks prior to the procedure, and you hold like 3 days prior to the procedure to make sure you are not less than 2. So it still depends on what your dentist want or expect you are not level or goal for the procedure. If you have to hold your eye hold your warfarin for 5 days prior to the procedure. Okay, sometimes they have difficult or multiple tooth extraction. They might want you to hold for 5 days prior to the procedure. They want the INR level less than 1.5. And you need to hold your warfarin might be for 5 days or more, depending on your iron level. So you have to follow your doctor closely to make sure uh, you don't have any help needed. So if you have to hold your warfarin for 5 days to get the iron uh, at less than 1.5, then you may need to be breached with the low enough injection or enoxaparin injection to avoid, you know, the blood clot or stroke, because you take warfarin to prevent the blood clot or stroke. And then if you require to reach with the low enough injection, then there is a instruction, when to start the low enough and when to resume low enough injection. You have to follow the doctor who manage the doctor who managed your warfarin. Um, if you take Eliquid, Xarelto, or Badaxa, it's easier to manage prior to the procedure. Um, Generally, for a simple extraction, you don't have to hold Eliquid, Xarelto, or Badaxa. But for multiple tube extractions or extensive oral surgery, then you might need to hold for 1 to 2 days this medication prior to the procedure. You don't have to be rich with the luminal injection when you hold less than 3 days. I think generally is safe, except for certain patients. Um, they are so sensitive when they hold their blood thinner medication, even though 2 days they may develop the blood clot or stroke. So for those patients, um, you know, the surgeon or the proceduralist might need to consider the risk and benefits of holding the blood thinner medication. So that is very complicated. Patient need to work closely. They may need to be uh, stay at the hospital uh, before the procedure to make sure they are safe, or stay after the procedure for days to make sure they are safe from bleeding or blood clot or stroke. If you have to hold your warfarin or the Aliquid, Xarelto, but that's then um, resume your blood thinner medication as instructed by dental or the surgeon. So, prior to the dental extraction procedure, you need to know if that a single extraction or multiple tool extraction. If simple extraction, you may not need to hold your blood thinner medication. If multiple tools extraction or extensive oral surgery, then you may need to hold your warfarin for 2 to 5 days, depending on your iron level. And then if you hold more than 3 days, then depending on your medical condition, you need to be breached with the luminal injection to make sure you are safe from blood clot or stroke. And if you take Aliquid, Xarelto, or Badaxa, You may require to hold 1 to 2 days prior to the multiple tooth extraction or extensive oral surgery. And then um, you should resume your blood thinner medication as instructed by your uh, dental. And if you have to be bridged with Lovenox injection, then you have to follow uh, your doctor who manage your, what day you need to start the Lovenox and what day and when you resume your Lovenox and when to stop the Lovenox injection. All right. If you have any further question for this dental extraction procedure, please let me know in uh, comment below. Thank you. Prior to dental fillings procedure, what should you do if you are on blood thinner medication, such as warfarin, Eliquis, Xarelto, or Bedaxa? You don't have to hold your blood thinner medication prior to a dental fillings procedure unless otherwise as instructed by your doctor who manage your warfarin or your anticoagulant or um, your dental or your oral surgeon. Okay. Um, if you have a unstable, you have an unstable INR history, then you may consider to recheck your INR. If you have uh, a critical INR recently, then you should check your INR, make sure your INR is not too high prior to the procedure. If you have any active bleeding, you should let your dental or your surgeon know that you have active bleeding. But I don't think that they need to do. They need to postpone the procedure. This procedure that you have bleeding, you are not too high. But if you need to talk to them to make sure they don't do anything else inside the fillings. They require you to hold your warfarin, and you need to follow your doctor who manage the blood thinner medication or the anticoagulant. And if they require you, if you're taking the Eliquis, Xarelto, or Bedaxa, and they require you to hold your blood thinner medication, okay, prior to the procedure, you have to hold. And if you have to hold your blood thinner medication, then you resume your blood thinner medication instructed by your dentist or your surgeon. If they don't have any recommendation, they have no idea when to resume, then you need to check with your doctor who manage your blood thinner medication or the anticoagulant, the when you should resume blood thinner medication. If you don't have any higher bleeding after procedure, then might resume the blood thinner medication the day after the, or even uh, same, same day of the procedure, you have no bleeding. So, all right, so again, before a dental fillings procedure, you don't have to hold any blood thinner medication. That's otherwise that's instructed. And then you don't have any stable INR history, critical INR recently, then check your INR to the higher bleeding risk procedure. And I just say for the fillings, you should not worry about INR history of bleeding. But if you have live threatening bleeding, probably do anything at the hospital eye, then they have a puzzle patient push your bleeding back to normal. All right. If you have any further question or concern, write to a dental doctor. Please let me know in the comment. Thank you. Good Friday, everyone. I would like to talk about pharmacy law today. Um, a lot of patients and some pharmacists confused about pharmacy law every day, especially um, retail pharmacists uh, and people who work um, at the chain pharmacy like CVS, Walgreens, Walmart. Um, they face with the pharmacy law every day. So I would like to talk some important pharmacy laws that may be benefits for both patients and pharmacists folks. So I would like to talk about Schedule 2 to 4 controlled substance prescriptions. Schedule 2 uh, is different uh, with Schedule 3 and Schedule 4 and Schedule 5 and the prescription only. So the Schedule 2, like oxycodone, um, you know, hydrocodone, morphine, uh, those medications, controlled substance, Schedule 2 or C2 prescription. So first, I would like to discuss about day supply. Okay, so excuse me. So the day supply of C2 prescription, um, the maximum day supply for the C2 prescription is 30 days. But for some C2 medication, the maximum day supply can be 60 days, like for those medication or the dextroamphetamine or methylphenidate for the ADHD. So those medication um, can be 60 days supply. And some injectable infusion medication during the bumps, um, they may be okay for 90 days supply. So for these day supply limit is a different and vary state to state. So may need to check with your state law to see uh, what are they supply limits for the Schedule 2 prescription. And the Schedule 2 prescription cannot be refilled. It's prohibited. So no refilling for Schedule 2 prescription. For some reason, prescription for Schedule 2 might be partial fill because they don't have enough medication in stock, so they are out of stock medication, and in that case, the pharmacist may um, give you some partial fill, but it's very complicated to do the partial fill You know, pharmacists need to um, dispense the rest within 72 hours, and if after 72 hours the patient not come back for the remaining, then the pharmacist must report to the prescriber, the doctor who prescribes the medication. This little, it has some uh, a complication if something happened after the buzzer fill. Um, and then it not permitted probation request, so the patient cannot request a buzzer fill. Uh, the buzzer will only occur if the pharmacy does not have enough medication in stock. So how long the Schedule 2 prescription is valid? Depend on state. Some state, uh, it set the time limit like 30 days limit. After 30 days, uh, the prescription is no longer valid. So um, you may need to get a new prescription for C2 medication if you cannot fill medication within 30 days. But for some medication, for some patients, like patients in long-term care facility, like a nursing home patient, or patient with a diagnosis of terminal illness, and the prescription may be valid up to 60 days from the day of issuance. So um, for the patient, the prescription can be filled within 60 days from the day the prescription was issued. So this is very important numbers and informations when you have the prescription for Schedule 2 controlled substances. You need to know some basic information to avoid, the prescription become invalid, and make sure you get enough medication, the total quantity, prescribed instead of production field. If you uh, don't get a production field within 72 hours, then you cannot get the rest of the medication. And remember to fill the medication within 30 days. No refills permitted. Um, and then understand the state laws to make sure, if you have the prescription for dextroamphetamine or methylphenidate for the ADHD, and some injectable infusion bombs, the medication for infusion, then you need to, make sure you fill the medication within the time limits. All right, if you have any question, please let me know in the comment below. I'm going to talk a little bit about Schedule 3 and 4 prescription. So Schedule 3 and 4 prescription. There you go. Schedule 3 and 4 prescription. So again, the day supply, for state law, some state law is the maximum 30-day supply per single filling, or be spent at one time. Federal law say maximum 34-day supply per single filling. But only a 5 refill and 6 months. You only have 5 refills within 6 months from the day of issuance of the prescriptions. So after 6 months, you cannot fill the Schedule 3 and Schedule 4 prescription. Make sure you know the time limit. And only fill 30 days supply or 34-day supply per single filling. Okay, so as long as you have enough for medication for 6 months, if you have 34 days supply, then probably you don't have 5 refills, maybe 4 refills. So it might be we need to do some calculation of for 6 months is equal 24. Probably you have 4 refills if 34 days supply. For box refill, yeah, if the pharmacist unable to supply the prescribed quantity due to out of stock or the patient request, so it's different with the Schedule 2 or C2 prescription. C2 prescription, the patient cannot request a box refill. Okay, and then for state law, you might not exceed 30 days supply, and the total quantity in all box fillings may not exceed the total quantity prescribed. And then after 6 months from the day of the prescription issue, you cannot do a partial fill or any refill, nothing after 6 months. Again, the prescription may be valid for up to 6 months from the days the prescription issued. So these very basic but important information all patients and pharmacists should know to avoid any arguments when the time that the patient needs medication but cannot be filled, or too soon to refill, things like that. Generally, pharmacists may dispense the schedule prescription maybe only 2 days earlier. Uh, if the patient want to get the prescription too early, they only do 2 day, uh, 2 days early for most of the scheduled substances. All right, so this is some pharmacy laws that it occurs every day, and then you know some a lot of patients they don't understand this uh, why the pharmacist refuse to refill the medication too early, or why they cannot fill the prescription even though they have some refill remaining like that. And the pharmacist, I mean, the healthcare insurance may have some information. For example, if you fill the prescription multiple pharmacy, uh, the your insurance may let the pharmacist know that you already fill this medication from the other pharmacy. So the pharmacist will know if you already got the medication for the pharmacy. Right? If you have any question or concern about this pharmacy law, please let me know in the comment below. Thank you for listening. So, I'm going to continue some very important pharmacy law. This is just for patient information. Good to know this information when you have a prescription, get it filled at the pharmacy. So, the last time I talked about Schedule 2, Schedule 3, and Schedule 4 controlled substances prescriptions. Now, Schedule 5 controlled substance prescriptions, or C5 prescriptions. Again, you need to understand the day supply on the prescription. So, no federal or state law regulating the quantity of this prescription, C5 prescription, or Schedule 5 controlled substance prescription. So, no law saying, how many they supply, I need anything, any one time. For the refill, no specific or set time limitation. So, for the C5 prescription, the law doesn't say how many days supply can be refilled. It's not like C free and C prescription. It limited 30-day supplies. So, but many states, may limit refills of C5 prescription by refills within a 6-month period. It's like C3 and C4. C3 and C4 it limits to 5 refills within 6-month period. So it depends on where you live. Your state may want set the limit, set the time limitation C5 prescription. The C5 prescription may be fracture fill. So there is no law regulating fracture fill for C5 prescription. But the total amount of all fracture filling but not exceed the total amounts required. And when the prescription is expired, it's no specific or set time for expiration. So many states consider the C5 prescription is similar to C3 and C4 prescription, C3 and C4 prescriptions. Then the prescription may be just valid for up to 6 months from the day it was issued. So it still depends on your states. Okay. But if your state has no specific or set time for expiration, then the prescription might be valid for 1 year. But most of the insurance company and the pharmacy system is set up for 1 year cut off for prescription. In other words, the prescriptions become invalid after 1 year which were issued. This is very important information for you as the patient understand, why they give you certain day supply, and usually for those states who have no regulation on the C5 prescription, then they might fill up to 90-day supply. It's just like regular prescription medication for due to 90-day supply. But if it consider C5 prescription as the C3 and C4, then it may only give you 30-day supply. And again, check your state regulation to see if you can refill the prescription beyond 6-month period. And most of the prescription is not valid after 1 year. Those very important limitation of the prescription. You let me know if you have any question for the Schedule 5 controlled substances, prescription, or C5 prescription. Thank you. So the last part of this type of pharmacy law is prescription only prescription. The RX only prescription, or some states they say C6 or Schedule 6 controlled substance prescription, either RX only prescription or Schedule 6 controlled substance prescription. So the day supply, so no law talking about the quantity maybe dispensed at any single filling. So most of the insurance limit for 90-day supply. For people who travel overseas or something like that, might request 6 month supply, but like I say, most insurance companies limit for 90-day supply for the prescription only medication. And then some medication, it's very dangerous to dispense over 3 month supply, like over 90-day supply, medication like antidepressant or antipsychotic. Those medication, they might limit to 90-day supply maximum. Like medication like a Seroquel or Lexapro or some medication require to monitor your blood like Coumadin or warfarin. Those medications, they may not give you more than 90-day supply. That is the basic safety, not about insurance, not about the money. That is the safety. Most of pharmacists or the doctor, they don't feel comfortable, they are not comfortable to dispense more than 90. For the refill, yeah, there's no specific or set time limitation, but many insurance companies and pharmacy systems set for 1 year. After 1 year, you probably need to get a new prescription, or the pharmacy folks, they may call your doctor office to get a prescription renewed. Partial fill is permitted, however, the total amount or quantity in all partial fillings must not exceed total amounts prescribed per prescription. So when the prescriptions expire, I just say valid for up to 1 year from the days were issued from many insurance companies and pharmacy systems. No transfer of refill for the prescription only beyond 1 year from the day of issuance of the original prescription. So, the pharmacy cannot transfer your refill to a different pharmacy if the prescription beyond 1 year. So after 1 year, most of the prescription is invalid. Of insurance companies or pharmacy system. You may ask a new pharmacy call your doctor to get a new prescription or get the prescription renewed. That's all you can do. But the old pharmacy cannot transfer your expired prescription, to a new pharmacy. So this is very important information for you as a patient to understand how the pharmacy fill your prescription at local pharmacy. When they get your prescription, they look at the day of the prescription were issued, and then the day supply, the prescriber or the doctor want, and then some prescription, they like some chronic disease, you might request 90-day supply, like high blood pressure or diabetes, high cholesterol. Those disease, those medical conditions, a chronic medical condition require you to take for a long time, then you might request 90-day supply for your convenience. Then most of the pharmacists accept that request from you. You don't have to ask your doctor for that. You can ask the pharmacy to fill a 90-day supply as your request. And then you should know the most of the prescription is invalid or expired after 1 year. Then probably you need to get a refill before that. Otherwise, you need to have the pharmacist call your doctor office to get the prescription renewed. Some medication require you to see your doctor before they can renew. Most of the medication, within your mental health condition, like depression or anxiety or the psycho problems, and you need to see a psychiatrist before you get the prescription renewed. Or some medication required to monitor your blood, like Coumadin, need to get the lab blood test draw before they can renew your prescription. And like that, you need to work with your doctor. The pharmacy cannot help you with those things. And within 1 year limit, the pharmacy can transfer your refill to a new pharmacy. For example, you got prescription with 11 refills, and then the prescription after 6 months of the day of insurance of the original prescription, then the pharmacist can call to a new pharmacy to get the prescription transferred. But after 1 year, they cannot do that. The prescription is no longer valid in their pharmacy system. I think most of the pharmacy set the 1 year cut off for the prescription only medication. All right, so that's all about the prescription. You know, from C2, C3, C4, C5, and C6 prescription. And C6 prescription is the regular prescription or the RX only prescription. Each state they call different. And so you may have to check with your pharmacy, your local pharmacy, to see how they call the Schedule 6 controlled substance prescription. Sometimes they call the RX only prescription. Sometimes they call Schedule 6 prescription or regular prescription. If you have any further question or any concern, please let me know. I'm willing to explain pharmacy law. You know, if you confused or if you don't understand anything about pharmacy, please let me know. I want to clarify or make sure give you the good information that can help you understand why the pharmacy give your medication, why sometimes they don't. They review your prescription. Thank you. Have a good one. Some of my questions keep asking different goals. I know. So when you go to Google and go INR, there's I mean, here is a basically go up INR or the full range of INR is between 2 and 3 most indication, except for the mechanical mitral valve replacement or mechanical heart valve INR 0.5 to 2.5. That's correct, but for the other special INR is 2.5 to 2.5, and not only way the mechanical heart valve. Sometimes if people who have deep vein thrombosis or DVT or the AFib that cannot be controlled by warfarin with the go-to-3. For example, people have been taking warfarin with the INR rank between 2 and 3, but still have stroke or still have recurrent DVT or PD. They may increase the INR range to 2.5 to 3.5. Make sure they're not having stroke for the recurrent bleeding for people when they are at therapeutic level. And sometimes they have the patient additional medication like aspirin, then the current DVT, OPD, stroke, and take over. And sometimes some people very high risk of bleeding, they may want to have those patients a lower INR range, maybe have to be below 1.8. Sorry, maybe 1.5 to 2.5. So for those people, they are very high risk of bleeding. Every further question is how in vegetables. So you should eat some greens, but you need to be consistent with your vegetables. You should eat same amount of vitamin K or same amount of greens every day to make sure your warfarin stable in your body. You have to eat consistent. You need to know how to measure your vitamin K, phosphorus, or spinach or kale contain a lot of vitamin K. So if you eat, I would recommend that you should eat low to moderate amount of vitamin K. So if you eat half of a raw spinach for one day, the next day you should eat like 2 or 3 cups of raw cucumbers or tomatoes like that. But dark leafy vegetables or dark leafy greens contain more vitamin K, like kale, spinach. Light vegetables contain less vitamin K, like cucumber or tomatoes contain less vitamin K. So I would recommend that you should eat a low to moderate amount of vitamin K, but you must be consistent every day to make sure that your warfarin stable stabilize your body. Generally, when you see this question, can you eat food with vitamin K on warfarin? Yes, I would say yes. You can eat some food with vitamin K, but you must be consistent and you should know how to measure the amount of vitamin K in each food in order to make sure you eat a similar amount every day. What foods should be avoided when taking warfarin? Well, I don't think that you need to avoid any foods when you're on warfarin, especially the food affect your warfarin like greens or vegetable. But some foods, may affect your bleeding, like garlic, uh, or some other herbals, it may increase your iron, so it may increase your bleeding. So I uh, try to avoid those medication may cause bleeding. The vitamin K does not increase your iron level or does not raise your iron level. It decreases or it lower your iron level. So what it means when it's low iron level? So when your iron low, you are at increased risk of blood clot. When your iron level is high or critical, is increased risk of bleeding. That is why you have to make sure your iron are stable and in the range. Um, there are two typical range. One, the normal range for certain medical condition like EVT, AFib, the normal range between 2 and 3 for the INR. For mechanical heart failure, the INR level is between 2.5 to 3.5. So it depends on medical condition. You have a different INR range. You have any further question on this topic or the issue? Please let me know in the comment below. Thank you. Hello, Yatu. This is a good question. What is difference between both Tylenol? I say Motrin is a non-inflammatory steroid drug. So it's used for mostly for inflammation pain, like ache or muscle pain, muscle cramps, like that. Whereas the Tylenol is used for non-inflammatory pain, like my headache or my fever or my back pain. But just pay attention on the side effect for each of these medications so you profit. So, Motrin may affect your stomach like ulceration when you use very high dose or you take it in empty stomach. So, and then it may affect your kidney also. So, when you take Motrin, you have to take with a full stomach, and you can take 15 or 30 minutes after eating. And Tylenol may affect your liver. So you should not exceed 4,000 milligrams of Tylenol for any circumstance. So generally you take 500 to 1,000 every 4 to 6 hours, but do not exceed 4,000 milligrams a day. May affect your liver, especially if you have any liver disease. You should consider heavily um, when you take in Tylenol. Um, and when you know, drinking too much alcohol, you should avoid taking Tylenol. May affect your liver. So those this is very important to consider when you should take Tylenol or Motrin. That's pretty much what is different between Tylenol and Motrin. If you have any further question, please comment below. Let me know. Thank you. Hello. This is a very good question. Uh, Lots of people taking fish oil nowadays for their cholesterol um, and other medical conditions such as arthritis, inflammation, or uh, or the heart. So there are some drug interaction between fish oil and coconut. Um, some people may experience more bleeding or bruising when taking fish oil and coconut. So if you have any abnormal bleeding or bruising, um, you should report to your doctor. Anyway, before starting fish oil or any over the counters or herbals, you should check um, the doctor who managed your warfarin to make sure he or she aware of new medication or over the counters that may increase risk of bleeding when we are on certain medication such as warfarin. And I think fish oil may not affect other oral medications such as Alaquix or Eropa. Hi, Frank. Pam, it's a good question. Basically, this is a general question I used to have. Um, Typically, is no, we should not take Motrin while we are on warfarin because Motrin um, is a non-formulary steroid medication. It may cause bleeding when taken with anticoagulant such as warfarin or Eliquis, Yerotol, any type of anticoagulant, we should not take moderate. So if you are not allergic, not allergic to Tylenol, you should take Tylenol instead of Motrin. Hello, Yang Ting. This is a very good question. A lot of people ask me this question when I manage the community clinic. Yes, some people have to take both warfarin and aspirin. But not a lot of people. Some people have to take both warfarin and aspirin. Aspirin generally take for the platelet or certain people, certain patients have the AFib, but they don't have additional factors. So they only need take aspirin. But when they have additional factors like over 75 or have diabetes. So generally the JAK2 score over 2, they should take the anticoagulant instead of take only aspirin. But some people have to take aspirin and warfarin because they have additional conditions. For example, people who take warfarin for the AFib, and they have to take maybe aspirin for the stent. People who have the stent in their body, they may have to take aspirin for 1 year also. Some people have to take the other anti-platelet like Plavix. So depending on your medical history, your doctor or your pharmacist will review whether or not you should take both aspirin or warfarin. Thank you for your question. Do you have any other further question? Please let me know. Thank you. I am think uh, this is another good question. I think uh, generally for the major procedure or surgery, I would recommend to hold aspirin for 7 days, but you need to check with the heart doctor to make sure they are okay for how to switch from warfarin to Eliquix. So you can go to Google and type in switching from warfarin to Eliquix or Abixiband. You can find uh, about 400,000 results. Okay, but the first few um, website help you to understanding how to switch from warfarin to Eliquix or other direct acting oral anticoagulants. So for Eliquix, we'll switch to the Eliquix when the iron are less than 2. So, excuse me. So, for example, if the patient is therapeutic at the Coumadin clinic visit, I used to have the patient stop taking warfarin about 2 days prior to starting the Eliquix. So, at that time, I had time to send out the medication to the patient. For example, if I overnight, then the patient should receive the medication the following day. Or if the patient pick up the medication at the window at the pharmacy, then the patient have the medication ready to switch to the Eliquid from warfarin. So again, it depends on the iodine level, so we can um, eh, have the patient switch from warfarin to Eliquid from the outpatient setting. So if the patient inpatient or hospitalized, then it easy just stop the warfarin and try to retest the iron to make sure it's less than 2 before start taking the Eliquix. It's more easier for the patient to switch to the Eliquix when they're still at the hospital. But if the outpatient management, then you need to like stop the warfarin for 2 days. If the iron at the therapeutic level, and then start the Eliquis to make sure the iron less than 2. If the iron a little bit high, like 3.2 or 3.3, then I would go with recommend to stop the warfarin for 3 days prior to uh, uh, starting Eliquis. But what happened if the iron at the you know, really high, like 3.6 or above in the time visit, then I would recommend I would reduce the dose or take a partial dose and then retest iron in 1 week to make sure iron level therapeutic before switching to the elements. And when the iron at the therapeutic level, and just try to hold 1 or 2 days prior to the Eliquis, prior to starting the Eliquis to make sure the iron is. The COVID-19 caused VTE, the thromboembolism, venous thromboembolism, the DVT or PE, deep vein thrombosis or pulmonary embolism. You can go to Google, you can type COVID-19 cause VTE. It will show up, about 840,000 results. So the first few results indicate that the patient with the COVID-19 infection might experience an increased risk of venous thrombosis, the DVT or PE. So, and then you can see the most popular website in the medical field is uptodate.com. It also shows that the COVID-19 patient might experience the coagulation disorder. And then in the following website, Boston Medical Journal.com is also show that the patient with the COVID-19 are associated with the venous thrombosis. So, yes, the answer is yes, the COVID-19 might cause the venous thrombosis. So, I have experienced some patients who have the COVID-19 vaccine, and they experience the increase of the iron. So the COVID-19 vaccines might increase the iron number. It's not much. It's about between 0.5 to 1. For example, people who normally have iron around 2.5, they may increase the iron to 3.0 to 3.5 after vaccination. So, but it not last long. Usually they experience the iron increase in about 3 to 4 weeks. And after that, they back to the normal target, normal range. So in those 3 to 4 weeks, the patient who have increased the iron due to the COVID-19 vaccines are used to decrease the warfarin dose a little bit, like maybe just a half dose per week to make sure that I'm not outrange, it's not super therapeutic. So, excuse me. So yes, some people have a concern whether or not the COVID-19 vaccine affect the iron level or not. Yes, they, they do affect the iron level, but not much. Thank you. So how you switch from Eliquis to warfarin? You can go to Google and type in switching from Eliquis to warfarin. You buy about 300, more than 300,000 results from this search. But the top few website have some very important information for you. The first one say converting the Eliquis or Visiban. They recommend start warfarin and stop Visiban 3 days later. So this is correct, but it depends on the warfarin level. For example, the baseline for warfarin, before you start warfarin, you need to get the baseline warfarin. Okay? And the normal warfarin is usually below 0.9 or 0.9. So around that level is normal warfarin. The people never on warfarin before. But how about if the warfarin level at that time at the baseline very high, like 0.2, I mean 1.2 or 1.3, like that, and you may need to stop abicibin maybe days or so. And then the second option, they say maybe stop abicibin and then start the parenteral anticoagulant or the injection anticoagulant. So, like Lovenox, and then warfarin at the same time. So, for some people, they are very high risk of stroke or high risk of complicated situation. So you need to make sure that the patient not have any kind of life-threatening issue. So at that case, you may, when if you want to switch to warfarin, then you probably need to make sure warfarin at a therapeutic level. In order to do that, because it takes about 3 to 5 days in order to make sure that I get to into the therapeutic level. In order to make sure that they need to have some form of injection, like local injection, to make sure the patient is not risk of having stroke or dangerous blood clot. So that's about what you need to know when you switching from aliquid to warfarin. But you need to make sure you have the baseline iron, and then based on the iron level, you may need to to make sure when it's safe to stop the aliquid. Maybe 3 days later, if you have no more baseline iron, if you have high baseline iron, then you might need to consider to stop the aliquid a little bit sooner. And then if you think that the patient is very high risk of having stroke or dangerous blood clot, then you need to make sure that you have some form of the injection, like low venom injection, make sure the iron level at therapeutic before you stop the low venom injection. Make sure the patient not having stroke or dangerous blood clot, like blood clot in their lungs. Thank you. All right. So, how do we switch from warfarin to Xarelto or rivaroxaban? This one is a little bit different. Uh, you can go to Google and type switching from warfarin to Xarelto or rivaroxaban. You have about more than 400,000 results. Okay? And for the first few ones, there is some information that tell you how to switch to Xarelto from warfarin. So right here they say from warfarin, stop warfarin and start less than 3. You know that for the aliquid or Bedex, when I are less than 2, but for Xarelto it's than 3. Why? Why is different? Because Xarelto is kind of little bit, it has a little bit longer half-life. So when it has longer half-life, means the medication lasts longer, and then it take longer time to get to the peak effect. So when the iron is less than 3, so you stop the warfarin and start Xarelto. It takes some time for Xarelto to work in your body. So that's why they want the iron less than 3 instead of less than. So and then similar to aliquid, if the patient had the life-threatening blood clot or having high risk of stroke, then you may need to consider the anticoagulant injection, like luminol injection. So, I mean, when you want to switch from Yeroto to warfarin, and then you might need to consider the luminol injection to make sure the patient don't have any stroke risk or any uh, life-threatening blood. But when you switch from warfarin to uh, Yeroto, then you only need to know when the iron is less than 3. Then, but it's different from the hospital libation and the outpatient patient. So for in the hospital, you may monitor iron or recheck iron maybe daily basis to make sure iron less than 3 before you start the Yeroto. But how about the outpatient setting? You don't do the iron daily basis. How do you plan for that? For me, when the iron, for example, at the therapeutic iron, then yeah, I just tell the patient to stop the warfarin, and I overnight the Yeroto, or I send the patient to the pharmacy window so they can pick up the Yeroto and start the Yeroto next day, the same schedule they are taking warfarin. So when I know the iron therapeutic, it's between 2 and 3, then I'll say go ahead and stop the warfarin for tonight and start the Yeroto tomorrow. And I know the patient will receive the medication at window, or will have the patient tomorrow via the overnight service. And how about if the iron are too low? If it's too low, then I would just say take half dose of warfarin at their schedule, and then start the Yeroto the next day at the same schedule of warfarin. What happens if the iron are too high? Like 3.5 or 3.5 or 4, or about 3. So if it is if the INA about 3.2, then I would just say stop the warfarin for 1 day, and then go ahead and take Yeroto the next day. But if it's 3.5, then I might recommend to stop warfarin for 2 days prior to take Yeroto. If it's 3.6 or above, like 4, and then stop the Yeroto for 2 to 3 days. But if it's more than 4, then I will have to hold the dose and have the patient to come back, in 1 week, and to retest the iron and go from there. But I don't. If it's above 4, and I have to have the patient to recheck the iron. That's how I switch from warfarin to Yeroto. How to switch from Yeroto to warfarin. You can go to Google again and type in switching from Yeroto to warfarin. You have about 45,000 or 4,500,000 results. So that's a lot, but for the first few um, results, and learn how to speak to woven from the rotor. So they recommend that um, you need to continue your auto woven. You start woven and continue the year auto together overlap for 3 days. So you stop the year auto in 3 days. Switching from year auto to warfarin. Okay. So you start warfarin and then Yeroto, and then stop the Yeroto in 3 days. Okay, so hopefully in 3 days, warfarin start working. Okay, but if the in 3 days detect the I9 level is still too low, like 1.2, 1.3, 1.4, and I would continue Yeroto for 1 or 2 more days and increase the warfarin a little bit to make sure the patient is safe from blood clot. I should that to tell the patient to remember to stop Yeroto as instructed. Some patient they forgot to stop the Yeroto. So that's the main thing. The patient, you might call the patient, make sure they stop the Yeroto as instructed. Otherwise, may cause bleeding. So usually for the new warfarin start, you check the iron level maybe twice a week. Monday and then the next and Thursday or Friday. So I would recommend that you should, uh, you know, start warfarin and then stop the Yeroto in 3 days. And then recheck the INR. If the INR is still too low, then I would recommend continue for another 1 or 2 days. Then adjust the warfarin dose to make sure it's not too high and not too low. And then recheck in about 3 days to make sure the patient is not at risk of blood clot or stroke. And then to make sure the patient is not continue taking both medication, the Yeroto and warfarin. Okay. So if the INR is still very low and probably need to increase the warfarin to make sure it get to the therapeutic level. And have the patient to report any abnormal bruising or increased bleeding risk. Thank you. How to switch from warfarin to Badax? Go to Google and type in switching from warfarin to Badaxa. you have about 340,000 results. The first few top results, you may have some information. Here, pharmacist.com give you a very quick information. So you stop warfarin and start Adaxa when INR less than 2. So this is general recommendation, but how you apply if you are from the hospital setting. If you work in the hospital, you might check INR daily. So when is INR less than 2, then you start by that on the same schedule, start the warfarin. And Badaxa is twice a day doses. You take one capsule twice a day. How about the outpatient setting? If you check the INR and INR is less than 2, and the patient has the outpatient clinic and you are able to give the patient the medication, the Badaxa, then the patient can start Badaxa at the schedule of warfarin. Stop warfarin and start Badaxa. But when I'm at the therapeutic level, like between 2 and 3, so you have to wait, like hope for 1 day to make sure I'm less than 1 to 2 days to make sure I'm less than for the patient start the Adaxa. But if the patient need to, if you need to send the medication to the patient home, if you overnight, it may take one day. And then if the INA is at the therapeutic level, then I need to go 1 or 2 days, make sure INA less than for the patient. If the INA at the time of visit is like 3 point above the level, 3.1 to 3.5, then probably the patient needs to hold more than 2 days, like maybe 3 days. And how about if the INA, above 3.6 or so, then probably the patient needs to come back to reject INA, just hold one or a half dose or 1 dose to make sure that INA back to the normal range and then recheck it before further notice for further instruction. Depend on the INA level and inpatient or outpatient status to provide best recommendation when doing from warfarin to medicine. How to switch from Badaxa to warfarin or from a bigger trend to warfarin. So go to Google and I've been switching from Badaxa to warfarin. You have about 400,000 doses. And when you look at the first few uh, top websites, right here, stock warfarin and start the bigger trend when I'm less than lower limit of therapeutic range less than 2. Uh, Pharmacist.com recommend stop warfarin and start the bigger trend when I'm not. So, in the hospital setting, you can do daily iron. So you check the iron, it's less than 2, then just stop, open, and start the bigger trend. But how about the outpatient setting? At the time of business, when iron less than 2, then probably you can hold the bigger trend one day and then start the Badaxa. If the patient has the medication on hand, then you may, when I know less than 2, stop open and start the Badaxa. If the patient doesn't have the Badaxa on hand, like you need to overnight the medication, and like that, it may take 1 day or so to get to the patient home. So you need to, if the iron at the therapeutic level, then you just hold the bigger trend for 1 day or 2 days prior to start the Alexa. If the iron like 3.2, 3.1 to 3.5, then I would hold open for like 3 days or so to make sure that I'm not less than 2, then start the Alexa. But if it's greater than 3.6, I would hold the open for 1 day and have the patient come back in 1 week to recheck the INR before further instruction. So it depends on the INR level in order to recommend when, how many days need to hold the open in order to get the INR lesson or switching adapts. I'm talking about the Alaquix versus warfarin. So why you need some people take Alaquix or Abixaban versus warfarin? When you go to Google and you just search for it, Alaquix versus warfarin, you will have about 600,000 results. Okay, so for the first few one, you can find some quick information why they choose Alaquix versus warfarin or vice versa. So the first one from myheart.net, they say Alaquix is shorter acting than warfarin. Excuse me. So Alaquix is shorter acting than warfarin, and the blood thinner effect is quicker gain or loss after about 24 hours. Eloquent rarely require preaching because it is shorter acting and can be safely stopped a day or two before any medical procedure or surgery. Yeah, so it's eloquent image and the warfarin image here. It's not always the case. It is just uh, general information. I've been working for the Anticoagulants clinic for many years. So yes, Eloquix, you have to take one twice a day. Whereas the warfarin or coumadin, you take one tablet, one dose a day. So it have a longer half-life and it take a longer time to get to the peak effect and get into stable state. So usually warfarin take 3 to 5 days to start working in your body when you just start warfarin. And then it take 1 to 2 weeks to get to the beach. Like the peak. And then it become a stable state after 2 weeks or so. Eloquent is just similar to the low-enough injection or enoxaparin injection. So Eloquent is the fifth dose medication. Either take 5 milligrams twice a day or 2.5 milligrams twice a day for certain patients. So it works every 12 hours medication. You should take same time every day, every 12 hours, and then the warfarin the same time every 24 hours. Eliquis is very expensive medication compared to warfarin. Eliquis, even though you have a copay, it is very expensive, like $500 per month, and then about 1,000 or more for 90-day supply. Either warfarin is like $10 for 3 months or so, so it's very cheap. Eliquis is a new medication. I think it's available since 2018 or so, 2017 until now. It's been studied and it's shown that the Eliquis is effective just like warfarin. And for elderly people, it may be convenient. They don't, have to go with the confused dosing with warfarin. Eliquis just take one tablet